Hi everybody, today we'll be discussing about contrast-induced nephropathy. Here we see there is an impairment in the renal function. How? We see there will be a 25% rise in the serum creatinine from baseline or increase of 0.5 milligrams per deciliter in absolute serum creatinine value within 48 to 72 hours following IV contrast administration. So within 48 to 72 hours, like 2 to 3 days following IV contrast administration, you will see the rise in serum creatinine levels. Most common etiology cause pre-existing chronic kidney disease will be there. Clinical factors, they'll have advanced age, diabetes mellitus, peripheral heart failure, peripheral vascular diseases, hypertension, LV left ventricular ejection fraction of less than 40%. Precipitating factors are acute coronary syndrome, volume depletion, concomitant nephrotoxic medications they will be on, anemia. So these are all some of the predisposing factors, risk factors and clinical features. Coming to what is what happens, what is the pathophysiology. Coming to contrast media on the kidney, it causes direct cytotoxic effect on the proximal tubules of the kidney. It enhances cellular damage via reactive oxygen species. There will be increased resistance of blood flow in the kidney. When you do ultrasound, there will be increased resistance of blood flow. Here what happens, increased resistance are due to by causing increase in the blood viscosity by lowering the RBC deformity. So that there will be intravascular sludging causing local ischemia and activation of reactive oxygen species leading to tubular damage at cellular levels. So remember, when you do an ultrasound on this patient, there will be increase in resistance of blood flow in the kidney. Exacerbate the renal vasoconstriction, particularly in the medulla. This causes medullary ischemia and potential acute kidney injury. This is the pathophysiology. Coming to metformin and contrast-induced nephropathy. So diabetes mellitus, when they are on metformin, what will you advise them? Metformin naturally it causes lactic acidosis in the setting of kidney dysfunction and acute kidney injury. Remember, when he is on metformin, in the setting of acute kidney injury and kidney dysfunction and also on metformin, this metformin causes lactic acidosis. FDA recommends holding, you have to stop metformin on the day and of contrast exposure and 48 hours after the procedure. Remember, on the day of the contrast exposure and 48 hours after the procedure. If they have kidney injury, kidney dysfunction in the setting of this, it causes lactic acidosis. So in hypertension, diabetes, chronic kidney injury, there is a substance called ADMA, that is acyl dimethyl arginine. It is a potent inhibitor of nitric oxide synthase, and there will be decrease in nitric oxide production. This can be utilized as a marker of contrast-induced nephropathy, particularly in patients with adverse outcomes. One more substance is there, that is serum cystatin C. This is increased in patients with contrast-induced nephropathy. Cystatin C, highly accurate blood marker for estimating glomerular filtration rate to assess the kidney function, often superior to creatinine because it is not influenced by the muscle mass, age and diet. It is used to detect early stage chronic kidney disease. So next we'll see how do you prevent it. Suppose a patient has chronic induced nephropathy, contrast-induced nephropathy, what will you do? Thank you.